Hi everyone, good evening to all of you in the US and good morning to everyone in Singapore, and for everyone in between, thank you so much for joining us. I am Laura Thompson, one of the representatives from CALECIM, and welcome to today's webinar on the new JDD publication by Dr. Goldman, titled Red Deer Umbilical Cord Derived Stem Condition Media Combined with Ablative Resurfacing of the Face. Dr. Mitchell Goldman is here with us today. He is the Clinical Professor of Dermatology at the University of California, San Diego, and founder and medical director of Cosmetic Laser Dermatology in San Diego. He's also known as the grandfather of growth factors and is the co-founder of Skin Medica. So just so you all know, everyone is on mute. If you do have any questions, please hold them until the end, or if you notice at the bottom of your screen, there is a Q&A button. So if you do have any questions during the presentation, you can click on this button, write in your question, and then at the end of the presentation, we will have a 15-minute live Q&A with Dr. Goldman. So without further ado, I'd like to hand over to Dr. Goldman. Hi, Dr. Goldman.
Great, so you finally unmuted me, so that was good. So it's always good to be unmuted. Well, I just wanted to let you know that even though I am part of the medical advisory board of Kallisam, I'm also been involved in skincare for a really long time. You can see that I been a consultant for Johnson & Johnson in wound healing. I founded a company called Skin Medica, and I've consulted and am consulting with a wide variety of skincare companies. And this is part of the reason why I chose to really spend the twilight of my career with a really breakout company like Cell Research Corporation, which has Kallisam. So I'm just trying to now advance. Sorry for the technical difficulties. Seems I no longer have control. There we go. Okay, so when I first joined, the question I had is, what is Kallisam? And basically the word is derived from cord lining conditioned media, and that's where the name Kallisam comes from. And if we could have the next slide, because I no longer have control. And what umbilical cord lining stem cells are is they basically are pretty amazing cells. They're contamination resistant, they're avascular, and they're really easy to process in a laboratory to obtain both epithelial as well as mesenchymal stem cells. Next slide. You can see that the cells are really, really active. But throughout this whole lecture, we're not transplanting cells into anyone. It's the media, it's what the cells produce, and that's what we're going to be talking about. Next slide. So when you look at the stem cells and you compare it to other cells like mesenchymal stem cells from bone marrow, you can see that the purity of stem cells contained from umbilical cord lining is much, much higher. Next slide. In fact, when you start looking at the umbilical cord lining, it also has the highest yield of stem cells as compared to bone marrow, adipose-derived, placenta, wart and jelly, or for that matter, even plant-derived. And you can see that we can obtain 6 billion epithelial and mesenchymal stem cells from a single umbilical cord with this, the first growth. So you get this very high number of stem cells. If you compare it to other types of stem cells, like the fibroblastic stem cells, which I actually helped develop through the company Skin Medica, you can see that it's a very non-invasive to obtain the umbilical cord lining after the baby is born. It's very easy to process, has an extremely high yield of both mesenchymal as well as epithelial cells. And because it's fetally derived, it actually, you're going to see how it provides us with the best type of media and compounds. It also expresses HLA-E and HLA-G, which are very important. And next slide. So again, we're not using the stem cells themselves. We're basically using the media. So we're growing all of these cells in Petri dishes, and we're taking what is excreted by the cells, which is a balanced protein mix. And that's what is really the magic in our serum. They're very youth derived, and these proteins actually send out signals which encourage cell mobility and activate cells to either divide and to grow, or the senescent cells to die off. Next. When we look at the tissue lining, if we were to grow just epidermal proliferation in a petri dish, you can see that you get a 42% increased skin growth over 7 days if you grow them with mesenchymal stem cells media with Kallisam than if you do it without Kallisam. Next slide. But more than just, and this is actually another interesting part. If you basically have that petri dish and you grow a confluent layer of epidermal cells, and then you scratch it with the pipette that perhaps you can see here, you can see that you can have a total confluence within 40 hours as compared to when you do not grow the epithelial cells in this stem cell media. Next slide. What's more important is its effect on the skin itself, not just in a petri dish. And this is a three-dimensional in vitro skin construct. And you can see on the lateral side that when you grow the skin with regular media, it's very thin. But if you grow it with the Kallisam product, you have a 600% increase or thickening of both the dermis and the epidermis. Not only because it's making glycans to absorb water, but it's actually increasing epidermal turnover. Next slide. So a study was performed with 3 patients, a Chinese woman, 23 years old, a Chinese woman, 43-year-old, and a Caucasian male who was 51-year-olds, and they all had blepharoplasty procedures. And then they harvested the epidermal cells from those blepharoplasties, and they grew those cells either in a controlled environment or with Kallisam. And you can see that in all 3 of these patients, 23, 43, and 51-year-old, you had an increased fibroblastic exposure with more elastin production. And next slide. These cells also had an increased expression of hyaluronic acid. So the growth media in the Kallisam product is causing an increase and enhanced proliferation of cells, enhanced elastic fibers, and enhanced hyaluronic acid. Next slide. When you look at what is actually in the Kallisam product, there's soluble collagen, albumin, fibronectin, and hyaluronic acid, in addition to the consolidated peptides and glycoproteins, which are secreted by the umbilical cord lining stem cell. So that's the media. Next slide. If you want to know how it's harvested, there is actually a herd of red deer in New Zealand, And the reason there's this herd of red deer is they actually use the fur of the antlers as an aphrodisiac in China. And so when these deer reproduce, basically all we're doing is taking the placenta and umbilical cords, which the deer would normally eat, and we're taking the umbilical cord part, and that's where we're basically harvesting the cells. So no deer is ever harmed by using this product. Next slide. If you look at the competitor's source of stem cells, the TNS and the Skin Medica, which I developed, basically came from foreskin fibroblasts. And they're already really differentiated, and they do have growth factors, but not the same. They're very weak growth factors and proteins compared to umbilical cord lining. There's aborted human fetal skin, same thing. They're basically fibroblastic and they don't have the same differentiation potential. And then there's a number of plant stem cell lines, which really are pretty good for plants, but they have a limited effect on non-plant tissues. Next slide. The other problem is, you really can't use human products in Europe. And so this is basically the European community regulations prohibit the use of these human-derived products. And Kallisam is not human-derived. It's derived, again, from the umbilical cord lining of the red deer. Next slide. So what I'd like to talk about today is a study, and the study that we did was actually just published in the November issue of the Journal of Drugs and Dermatology. My fellows, Drs. Haas, Kolapara, and Wu, obviously assisted and conducted really most of the work of this study, but I'm the senior guy, so I'll present it. Okay, next slide. So the background is, many of us do CO2 laser resurfacing, and we do a lot of it in our clinic. And one of the problems that we've had is to try to accelerate wound healing, to make it an easier process for the patient. And then the holy grail would be actually to have a product which actually makes the results even better than the CO2 laser resurfacing alone. And so what we decided to do is try the Kallisam product, which we know is already useful to treat chronic wounds post-laser resurfacing. Next slide. What we did in our study is we didn't do split face because I was concerned that the growth media would transfer from one side of the face to the other, and or the effects, the chemical effects or histologic effects would also migrate to the other part of the skin. So what we did is we took 20 patients between 36 and 70 years old, all with Fitzpatrick skin types 1 through 4 with moderate to severe photo damage. And we took 5 of them and just did what we do normally, just vehicle control. And 15 were on the active product. And we basically graded them with the classification of wrinkling that my former partner, Dr. Fitzpatrick, and I developed a long, long time ago. Next. So what we did is we had our patients for 30 days before the actual procedure either use placebo or active product. And they used a cleanser. They either did the pre-procedure cream, which was a multi-action cream that I'll tell you about, and sunscreen. And then we did the procedure using a luminous active FX, where we used one pass to the entire face at between 80 and 100 millijoules, mostly 100 millijoules at a density 5. So it was a one pass laser resurfacing. And then for the perioral and periorbital areas, we did a second pass. And you can see it was with a density 5. So this was a real laser resurfacing. After the procedure, which we do on almost all of our patients, they did vinegar water soaks while they were awake. And then after the vinegar water soaks, they put on either the serum, the active serum, or placebo serum. And then we used a dimethicone-based ointment for dryness. After the patients were healed, which was around 7 days, we then had them continue to use the cleanser, but now we had them use not only the Kallisam cream, the Kallisam serum or placebo, but we also had them use the Kallisam multi-action cream or placebo. And next slide. So what is the Kallisam multi-action cream? This is a cream that actually works on its own, and we'll show you this in a few minutes, but it basically contains 50% of the active ingredients of the growth factor media. And it's been proven, and we'll show you that it pretty much restores facial definition, improves skin elasticity, actually lifts the skin, and enhances fullness. Next slide. And this is a typical type of patient where you can see before and 2 months after using just the multi-action cream. So this is not with laser resurfacing. You can see that there's a skin tightening and lifting effect, as well as an improvement in skin tone. Next. And then the serum that we use is this little pink bottle. This has an 80% concentration of the growth factor media. Again, significantly reducing redness, swelling, discomfort, aids wound healing, and enhances aesthetic results. Next slide. And in a, not a study, but a case report that was done many years ago by Dr. Kim in Orange County, where he used just the serum on one half of the face and nothing, just regular treatment on the other half. What he found, again, in doing fractionated CO2 laser resurfacing, is that there was a decreased swelling and decreased erythema, as well as discomfort when the serum was used. So this is really was the reason that we wanted to do this study. Next slide. So if we look at our patients before the procedure, they were basically identical. They were around the same age, average age between 57 and 60, with about the same degree of wrinkling and elastotic scores, same skin types, essentially. Next slide. This is actually one of my associate physicians, a very nice dermatologist who's about 48 years old. And he was not part of the study, but he is giving us permission to use his pictures. And we did a fairly aggressive CO2 laser resurfacing using a few passes, not just one pass. But you can see that he used the exact serum and MAC that we're using in the study on his whole face. And you can see how quickly he actually healed and how much more handsome he looks after the procedure. So it's good for men too. This is actually one of our patients on the study, a 56-year-old male, where again, we did 100 millijoules density 5, one pass on the full face, 2 passes around the eyes. On most of our men, we don't do a second pass around the mouth. And you can see before and 30 days later, he actually looks really good. Next slide. And a 52-year-old female, again, that 100 millijoules, which is usually what we use, 1 pass of density 5 on her full face, 2 passes around the eyes, and 2 passes around the mouth. And again, you can see at 30 days, she's looking really good. And these are both patients that were treated with both the Kallisam serum as well as multi-action cream. And now let's look at the actual study results. Next slide. So when we look at clinical improvement at week 6 and week 12, while not extremely statistically significant, probably because we didn't have enough numbers, you can see that it was a much better result when we use the active versus placebo or vehicle. Next slide. If we look at just the wrinkling scale, we can see that there was an improvement with the wrinkling scale. So again, patients got the same laser, but 5 patients did placebo or normal, and then 15 did active. And it was a not statistically significant, but significant decrease in wrinkling. Next slide. A statistically significant decrease in tactile roughness at day 30. Next slide. A significant difference in erythema, which started around day 5 and was significant even to day 30. And as all of you know, the only real erythema you get after this laser resurfacing is when in that second pass around the eyes where the skin is really thin, but that was statistically, that was very significantly better. Next slide. Dryness was also improved starting around day 7 with the active versus vehicle. Next slide. And then healing was also improved. Healing started to be improved very quickly by day 1. You could see increased healing. Day 7, of course, 14, it was much healed. And then, of course, the healing is basically levels out over time. Next slide. And then patients noted that their skin quality also appeared better with active versus vehicle. Next slide. And then we asked patients a number of different questions. We asked patients if their skin was soothing and if the products felt soothing and calming. And so this was vehicle versus active products. And the active products were more statistically significantly more soothing and calming than vehicle. Next slide. The active products were statistically significant, helping with post-procedure sensitivity, which started at day 1, but you could really see it at day 5, which is really when the skin is usually most sensitive. So for those of you that do a lot of laser resurfacing, that's when you start getting the patient complaints, is around day 3, 5. And so you can see this is when we have much less patient complaints. Next slide. And just in general, we asked patients how they would grade their experience. And again, especially in the early day 5, day 7, they were significantly happier with their post-procedure serum than with the placebo. Next slide. And again, their skin felt more soothing and calming with the multi-action cream, which was given starting around day 7, then with the multi-action cream without the active ingredient. Next slide. Again, their experience was better, statistically significantly better using active product. And next slide. And so you can see here on the top is a patient that just had vehicle, and the bottom is a patient that had the active product. And these patients were treated with identical laser settings, same age, same degree of pre-photo damage. And I think it's pretty apparent that you can see that increased healing starting on even day 1, and especially day 5 with the decreased erythema. And this just shows you up to day 14, not going out further, but I think it's a pretty representative sample of why patients like the active product better. And next slide. And one more. So what does it all mean? It means that this is what we do in our clinic when we perform laser resurfacing, which we do virtually every day. We see that the Kallisam serum and multi-action cream reduce the downtime improved the skin quality, healing, has increased patient satisfaction. And then I think one of the most beneficial things is it actually makes the procedure better. It improves wrinkling, and so it enhances the results of our laser resurfacing procedure. Next slide. So this is another study that we actually did a year ago, so 2 years before. And this was just to test what is just the multi-action cream and the serum do without laser resurfacing, so just on regular skin. And this was done again with my fellows, Dr. Al-Haddad, Bowen, and Wu. Next slide. And again, the fellows did most of the work. Now, in this study, we basically tried to do a split face study because we weren't doing laser resurfacing. So I felt more comfortable doing a split face study. The problem again is that there was probably some crossover of product from one side to the other, especially when the patients are sleeping. And so maybe in the future, someone else can do a better study where again, they're doing maybe 20 patients with placebo, 20 active, because the split face may not be the best study in the world to do. But we did it for 12 weeks. The only other products they used was a generic moisturizer and sunscreen. And again, we used our Fitzpatrick grading scale and a 4-point wrinkle scale. This also may be one of the problems. We may have been able to get better results using a more detailed scale to grade our patients. Next slide. So even though there were these potential problems with the study that if I was doing it again, I'd probably correct, but patients did like the active compound better for their improvement in wrinkles than on the active side of the face than on the vehicle side of the face. They felt that they had better skin turgor, and they were much happier with the active than placebo. And so it really does work. And I think we probably could have even done better if we would have done the study a little differently. Next slide. And this is just an example of one of our patients. And I think it's pretty clear, especially on the next slide, where we can really see a decrease in even those deep wrinkles. And so why is this? It's because I believe we're improving the elastic fibers, we're improving skin hydration, and that's what causes the lifting effect. It's also very obvious to see that the skin quality is improved. And then when you look at her she had these little acne lesions, and that actually improves as well. And so we have found that the Kallisam products do not cause blocked pores and acne, actually the opposite. Next slide. Another one of our patients, again, pretty severely wrinkled, but I think you can see if we go to the next slide, there actually, I think, is a real improvement. And again, the deep wrinkling here in the cheeks and the forehead. Again, these were taken with the 3D Vectra analysis photography unit. So the best photography unit that we presently have. So we really do see that there's increased hydration, increased elasticity and lifting effect of the multi-action cream. Next slide. And this is versus placebo. Granted, it's a slightly younger patient, but we really see no change when we're using the placebo or vehicle creams. Next slide. And that was the vehicle side, and now this is her active side. And again, when we look at the active side, I think it's clear that the skin appearance is better, as well as a decrease in the wrinkling. Next slide. So I think the multi-action cream is really good. As we've seen, it's really good on its own. And then I think the real key thing is by doing a procedure and using the Kallisam system after the procedure, not only does it make the healing and the procedure go better, but it actually may just improve the good results that you're getting from your procedure. Now, whether this translates into things like microdermabrasion or radiofrequency microneedling has not yet been studied, but I would assume that these same results that we're getting from using fractionated CO2 or confluent CO2, which is the active FX with the density 5, can be readily translated into all other forms, if not, I think all other forms of any skin lasers or radio frequency microneedling or other techniques that we're using. Next slide. So that's what I have from San Diego, California. And now I'm here for questions.
Amazing. Thank you so much, Dr. Goldman. That was fantastic. So we'll just open the floor to some questions. So please feel free to write them in the Q&A box or in the chat at the bottom, and we'll go through them. Or if you'd rather ask a question live, you can click the raise hand button at the bottom of your screen, and we can unmute you, and then you can ask your question directly to Dr. Goldman. So we'll just see if there's any questions. I think we have a couple raised hands. Okay. Okay. So Mohammed Akbar, I think you should be able to unmute yourself, hopefully. Sorry about this, slight technical difficulty. Okay, so we'll start, just while we're figuring that out, we've got some questions through in the Q&A box. So the first question for you, Dr. Goldman, is can patients use the serum as part of their daily skincare?
Yes, a number of our patients do. The serum is a little more pricey, but for those patients that really want to get the best result, they do use the serum underneath other products. Remember, the serum has an 80% concentration of the growth factors, whereas the multi-action cream has a 50%. So they're getting more of the growth factors, and I tend to recommend this serum when patients are also using additional skincare products such as skin brightening products and antioxidant products. So it can be an additive.
Brilliant. Someone's asking, how long does Kallisam take to improve skin fullness as well? That's the multi-action cream.
Yeah, it's a great question. In the studies that we've done, it was 30 days. That's when we could start to really differentiate vehicle from real. Now, most studies that I've done before and that many people do, it's usually around 60 days, so around 2 months. But I think one of the benefits of Kallisam is that people are going to start to see the results a little bit sooner. Interestingly, the amount of product in the multi-action cream is usually it's a 2 to 3 month amount of product. And if you get the 5 Kallisam little bottles, it also lasts for anywhere from 2 to 3 months. So for sure, by the time they finish, they should be seeing really nice results.
Brilliant. We've got another question. So do you apply the serum immediately after the laser procedure? And also,
yes, So absolutely. While the patient is still in the operating theater, as soon as I'll remove their eye shields, and usually with our procedures, there's not any bleeding or anything like that. And so we'll immediately apply and massage in the the serum. And then we put on a little bit of wet gauze, cooling gauze, because those of you that do the procedure know there's a little bit of heat associated with it. And so we'll do some cold air cooling. And then when the patient is calm and there's no more heat sensation, we'll remove the little cold gauze and we'll reapply some more of the Kallisam serum. Then we apply a silicone-based dressing like Apply, but there's many others around. And then the patient goes home. And then just for completeness, when the patients go home, we advise them the next day, they take a shower, they use the balls of their fingers and a gentle cleanser to cleanse their face. Then they do vinegar water soaks. After the soak, they put on the pink serum, and then again, the Apply or the silicone-based ointment. And then they'll repeat that every few hours while they're awake. And if patients can do it 3 or 4 times a day, I think that's perfect.
Brilliant. And that sort of follows on to another question. Someone was asking, what is the principle behind the vinegar soak?
Well, as we all know, the most important thing, well, one of the most important things is to prevent infection. And so what we found, and Fitzpatrick and I published probably 25 years ago, because we developed laser resurfacing 30 years ago. So what we found is infection. And what were our patients being infected with? Most likely gram negatives, not staph, but gram negatives. And so the vinegar water basically just destroys like Pseudomonas and any gram negative. And also it's very soothing. There are other products on the market now that are like hydrochloric acid products. In the United States, we have something called LaserCyn, CYN, and we can use that as well. But just a capful of vinegar and a cup of water, I think works really well, is very inexpensive. So it's soothing and antibacterial, especially for gram negatives.
Brilliant. Someone was asking, what was the placebo serum that you used in your study as well?
It was the exact same product without the growth factors. So what the company did for us is they gave us bottles that said A and B, and we did not know what was in A and what was in B. And that's what we used for the study. So we were blinded, as well as the patients, to the type of cream that they were using. And so the company manufactured the cream so that they were identical except for the growth factors.
Brilliant. And then how much serum did you actually apply? Did you use the full ampule post-procedure, or how much did you use?
No, that would be, if you were incredibly rich, I guess you could, but it's really just a few drops. It's like 3 or 4 drops on one side of the face, 3 or 4 drops on the other. So typically that little bottle that we saw, that should almost last for about 3 days or so when patients are really doing it aggressively. If you're just doing it like at home without laser resurfacing, then really you only need 1 or 2 drops on each side of the face. And so that little vial can end up lasting at least a week, if not more, like 10 days.
Yeah. And then we've got some questions about sort of other treatments that you can use the serum with. So things like microneedling, chemical peels, things like that.
Yeah, I really think this is a phenomenal for microneedling. I've been trying to get the company to actually do a study on that. I hope one of you guys can do a study. And then radio frequency microneedling, it might even be better. My problem with chemical peeling, as we know that when we do a chemical peel, we're actually like frying an egg. We're denaturing all the skin proteins. And I don't know if the serum is going to penetrate through that until the skin exfoliates. So chemical peel, I'm not sure on, but definitely microneedling and definitely radio frequency microneedling.
Brilliant. And then someone's asking, so they live in a tropical humid country. Do you need to keep the products refrigerated?
Well, one of the brilliant things about the product, especially the little pink bottle, is that's a pH indicator. And so if it's not pink, it means it's bad. Now, San Diego is not a tropical area, and it's actually a coastal desert. So the average humidity in San Diego is anywhere between 40 and 60%. And I have never seen the products turn bad. I think the reason for refrigerating it, as in any product, is it is going to make it last longer, and it's going to feel better on the patient's skin if it's refrigerated. But I don't know the exact answer. I would kick that back to the company.
So can the serum be used after laser treatments for pigmentation as well? Have you ever studied this?
Well, I guess you're referring to if you're using a fractionated 1927 thulium laser, which is the laser commonly used for pigmentation, whether it's the Fraxel Dual, Clear or Brilliant, or now there's Lutronic has one. There's other companies that have them like Candela. I would think yes, because although the pigment directed lasers are always more superficial, you are producing little teeny holes, albeit superficial, in the skin. So you may actually get better penetration.
Okay. And then so someone was asking about using the serum with LADD. And what are your thoughts on this?
You know, okay, with all due respect to people that like LED, I've never seen it really do much for rejuvenation. But I would assume that if you're seeing great results, that's wonderful. And this will potentiate and make the results even better.
Okay. And then just from a patient's perspective, is sort of stinging and slight pain normal after applying it immediately post-procedure?
Yeah, there is just a teeny bit of stinging, but it literally lasts for just a few seconds. And so what I tend to do is tell the patient, look, it means it's working. And as long as the patient thinks, okay, it's only going to last a few seconds, and oh, Dr. Goldman says it's working, then they can live through it. But seriously, it's only a few seconds. If it stings, it's just a few seconds.
Mm-hmm. And then how long will the serum last once it's opened? We do get this question.
Again, the beauty is it's got that pH indicator in it, which turns it pink. And again, in my experience in San Diego, I could go up to my medicine cabinet and look at it now, but I've never seen it turn color. So I think it lasts a long time, but I would go to the company to figure out exactly what the correct answer is.
Mm-hmm. And I think that is pretty much everything from the Q&A section. So if anyone does have any other ones, feel free to click the raise hand button and we can unmute you or pop them in the chat. Seeing one more. So instead of the gauze, can we apply a mask with the serum after the procedure?
You know, whoever, I don't know who, it would be nice to know who's saying these things because you guys are like really, really smart. Yes, I think a mask would be brilliant because as we all know, the masks are soothing in and of itself, and it may further increase the penetration. So maybe the company is going to be developing a product that actually has the multi-action serum in a mask, because I think that would be absolutely brilliant.
So I think that's pretty much all the questions. If anyone has any others, please feel free to email us at customerservice@calesim.com or contact your local account representative. But thank you so much, Dr. Goldman, for your time, and have a great rest of your evening. And thank you so much to everyone for coming online. We have recorded this, so we'll get that out to everyone as well. And thank you all. See you soon.
Cheers.